I'm a physiotherapist, and I'm currently doing a year of locum work. So I'm currently living in Hervey Bay in Queensland, and I'm working for a NDIS provider. So I'm working with adults and kids with disability.
Terrific. And what training have you done to get to this point in your career?
Yeah, so I guess that's where my generalist experiences have sort of come into play. It was really my experience in Broken Hill, working with children, that sort of sparked this interest into sort of doing this role. And that's a big reason why I've decided to delve deeper into pediatrics and adults with disability.
Terrific. And where did you study?
I studied in England actually. So I did my degree at Brighton University in England in 2011. Yeah.
Okay. And you mentioned Broken Hill. Can you tell me what you were doing there?
Yeah, so I always wanted to, after working in some of the big hospitals in Sydney, I always wanted to experience sort of rural work. And so I decided to go to Broken Hill because I'd heard a lot of positive things about the hospital there. And so, yeah, I started there in 2018, and then 2 years later, I finished up there. Yeah, and I've really, really enjoyed it, and I guess that's why I decided to, partake in this interview, because I'd really like to encourage health professionals to do rural work.
Great. So before you went, you said you were working in metropolitan Sydney, but you
Yeah,
always wanted to go rural. What
yeah.
was it that about rural that appealed to you before you went?
I think I've always been really interested in working with, Aboriginal and Torres Strait Islander communities. And there was just something about the outback, um, and the red dirt and, real sort of country lifestyle that interested me. So that's why I decided to move out there for work.
And so you had a perception of what it was going to be like before you went.
Yeah.
How did that compare to what it was like when you were there?
Yeah, so it's funny because my family, they were like, oh, why don't we go there for a weekend so you can see what it's like before you actually sort of move there. And I think part of the adventure for me was just not really doing that. So I just decided, like, nope, I had my heart set on Broken Hill. I'd spoken to a lot of physiotherapists who worked at St George Hospital, who, when they were new grads, they do like a secondment out there, and all that I heard was positive. So I just sort of had my heart set on it and just decided to go ahead with it. I guess I knew it was literally in the middle of nowhere, and I don't know. I guess it was better than what I expected. I expected to be in this tiny remote community with, one shopping, one shop, a post office, the police station. Like, that's what I expected, and Broken Hill exceeded that. There's so much to offer there. So yeah.
Great. And so would you have a typical day or a typical week when you were out there?
I would say no. I think that's what I really enjoyed out there was the no day was the same. So you really have to work as a team, and you have to be flexible to, to go from one area of the hospital to another area within a day. So a day for me would look like, starting off in the morning, maybe on the acute wards, having a patient in the outpatient department in the afternoon, then, being paged to help out in fracture clinic. It was just different every day, which I think I really enjoyed.
Right. And you said you had to work as part of a team. What other practitioners or specialties were you working with when you're at the hospital?
Yeah, so at the hospital, I very much worked I worked with nurses, with doctors, with other allied health professionals. So with the speech pathologists, occupational therapists, dietitians, allied health assistants are readily used in Broken Hill or in remote sort of hospitals, regional hospitals. So it's really about working with them to provide great patient care. A part of my job was also to work with the Royal Flying Doctor Service. And so obviously then I would be working with the RFDS GPs, with their dentists, you know, with their nurses, with their drug and alcohol team. When I used to go to remote communities, I'd actually work with Marima, which is a Aboriginal primary healthcare service. So yeah, I really worked with so many different people.
Can you give an example of something you did with the RFDS, a case that you're involved in?
Yeah, so I guess we really try to sort of provide consistency to the community. So across our physio department, we would sort of be delegated a town. So my town was Wilcannia. So Wilcannia is about 198 kilometres drive, you know, between Wilcannia and Broken Hill, and it would take about 40 to 45 minutes on the plane to get there. And you know, my day would vary as well, but I would spend the morning working in the emergency department and in a residential aged care facility, because they had 5 beds there. And I'd really be just making sure that the residents there were getting up and about safely, checking in, have they had any falls, providing them an exercise program, and so forth. And then in the actual healthcare clinic, I'd be seeing my regular outpatient patients. So it would vary from, you know, chronic back pain presentations to, you know, to total knee, total hip replacement, physiotherapy. It really varied, to be honest. And I think with me being consistently there once a month, I developed a real good rapport with those patients. And so they would come once a month to my appointments, which was really nice to see. And I really experienced good progress with them.
Terrific. And is there a difference in the sort of cases you would see in a rural area versus the metropolitan hospitals you're working in prior to that?
I think so. You definitely come across some crazy stories, you know, for example, you know, motorbike versus kangaroo, like, you know, all these crazy stories that you wouldn't get in cities. I think the biggest thing is the limitation in our resources that we have there. So, and the lack of, you know, the limitation of resources, but also the lack of specialists. So, you know, you really rely on liaising with bigger hospitals to sort of ask for advice and ask for recommendations. And yeah, I think the biggest part is really just working as a team, not only within what you have, you know, at that clinic, but then also not being afraid to reach out to those bigger hospitals to ask for support.
Yeah, and what are some of the rewards of working like you? It's obviously a very challenging environment for some of the reasons you've just mentioned.
Yeah.
Why do you do it? What are the rewards?
I think for me, a big part of it was just like career progression. I think you can, you know, in the bigger cities, there's a lot of competition around sort of, you know, being able to get experience in an area that you might be really interested in. And what I experienced in the cities and the bigger hospitals was I'd have to wait, you know, 6 months to get an extra rotation or to be considered for a rotation. And for example, for me, that was the pediatric side of things. So coming out to Broken Hill, I was able to, you know, be the pediatric physiotherapist, and I was supported to get further training in those areas. I really wanted to do student education, be a clinical educator, so I was able to put my hand up and get that training and dive straight in. So I think if you really want to be involved and you want to be part of committees and you want to really push yourself to progress in your career, you've got a lot more opportunity in the remote and rural communities. Yeah, what else? I think the lifestyle. I think you know, there's no traffic. You spend 5 minutes in the car getting to work. You could even ride your bike to work. there's so much more time outside of work to live more of a balanced life. So that was sort of a reward. And also just, I think, delving into the simpler life, you know. Yeah, those were things that sort of drew me, and those were big rewards.
Terrific. And some students have expressed concern about leaving friends and family. What's it like to go into a rural community on your own without people that you know?
Yeah, I mean, I think it's definitely daunting, even for me. You know, I'm doing locum work now, but I think people that decide to go and work remotely, they all have the same approach. You know, everyone goes out there to sort of experience and to have an adventure. So what I found is that all the friends that I made out there were very similar to me, in that everyone was ready to give it a go, be open-minded, put themselves out there. So you're never alone. I have to say, you know, there's just, everyone has such great energy, and you make friends very quickly, to the point where you have to actually say no to social activities, you know, because there's always something happening. So it's a fear that you have, but I think it's not something that you need to worry too much about, because you'll make lifelong friends.
Terrific. So in terms of keeping in touch with friends and family at home, how did you do that? And how were other people maintaining those connections back home?
Yeah, I think technology is great in that sense. You know, we have so many platforms that we can use to communicate with our families. My family were really interested in Broken Hill, and so my parents came out to visit me quite often. You know, my sister came out. Really, it's just a flight away. You know, you can catch a flight 2 hours and you're in Sydney. But yeah, just regular phone calls, people coming to visit, you going back home now and again. I think that's important. Yeah.
Yep. And so it is a big change from perhaps being in the area that you grew up, a familiar environment. To prepare, say, mentally for going somewhere remote, what advice would you have?
I would just say mentally, like, just be ready to be open to try to have an open mind about where you're going. The big thing is that you realize how grateful you are for being in a big city where you have access to anything. You know, whether it's like going to a Thai restaurant, or you know, being able to, if you injure yourself, being able to just go and, you know, have an MRI, like all those things. I think you become really grateful. So really just being open-minded about the experience and the adventure. And I think a big thing is, you know, if you decide to do, you know, 6 months there, or, you know, you're doing your placement, you have a choice to decide when you're there if it's for you or if it's not. You know, and you can always decide to sort of, you know, move back home. Yeah, I think that's a big thing, is that it's not forever. You know, it's a great experience and an adventure in your life.
That's terrific. Any practical tips?
Yeah, I mean, I would say the drive out there, you definitely need a car in Broken Hill. The drive is 13 hours. So if you can, you know, if you can have a family member or a friend drive out with you to share the drive, I definitely recommend that. And then they can just jump on a plane and, you know, fly back home. Keep an eye on your fuel tank, you know, there's not many fuel stations out there. So you really have to just make sure you've got plenty of fuel in your car, plenty of water, know how to change a tire if if that happens. Those are, I guess, the biggest things, you know, for getting there, I guess. Practical, I would say Broken Hill in itself is a community that love events. So like there's so many balls that you go to, you know, the footy club balls, RFDS balls. So definitely bring a suit or a nice dress with you. But yeah, and a camping gear, you know, bring a swag, bring a tent with you, because you're going to be doing lots of camping.
Sarah, you mentioned you're in Hervey Bay now. Can you tell me about Hervey Bay?
Yeah, so Hervey Bay is fantastic. It's a seaside town, obviously, just opposite Fraser Island. I'm really enjoying it. I'm working for a company that, you know, that has offers jobs to locum workers, and the agency that I've gone through have provided me with accommodation. So I'm living with an OT, I'm living with a speech pathologist that I work with. And once again, you know, everyone's here to travel, to work, to experience, you know, seaside coastal life, and that's what I'm doing.